Hi guys, this is Dr. Bhupesh once again, and now I will record this reading part C for you. Reading part B we have done, and now I will record the reading part C for you. So you ask me the questions, and I will do this, and will let you know where you are wrong or right. Question number 7th. It's a difficult question. If you want to ask, you can ask me.
Yes, sir.
Should I do? Okay.
Yes,
It's
sir, please.
it's out of those difficult questions that I'm mentioning, guys. Let's concentrate how to make difficult question easy. And trust me, this question was so easy, but it's just about when we are not in the positive set of mind. That is where we lose these marks. So please now read it with me and let's see how it goes. In the first paragraph, what does point the writer make about the treatment of depression? So please understand the main point. Treatment of depression. So the first you have to specify the question. My question is about, okay, I will ask you, this will solve all your problems. What is my question about?
About treatment of
Yes,
depression.
that is what I, no, depression nahi, treatment of depression.
Yes, treatment of depression.
This will also resolve your problems. This will also
Yes.
solve a lot of problems. So if I say 75 visit their GP treatment, this is regarding treatment. GP struggle to meet of the needs of the patient. This is regarding treatment. This is also regarding treatment. Okay, most people will okay, like this is all about treatment. So it does not really help me in this case. But yeah, I would be very careful about that. Is what reading is all about. You have to provide care at each step. At one of the step, questions tell you why I am wrong. Option tells you why I am wrong. So now I read it well, treatment of depression, but in all the four options, treatment was given, so I can't help it. But let's see how it goes. I will try to help it some other way. Okay. Okay. Now, depression remains the leading cause of distress and disability worldwide. In one country, survey of the health well-being in 2007, 7.2% of the people surveyed and experienced a mood affective disorder in the previous 12 months. So 7.2% of the people surveyed experienced a mood affective disorder. Okay. Those affected reported a mean of 11.7 disability days when they were completely, so in the 12 months, in the last 12 months, those affected mean 11.7 disability days where they were completely unable to carry out or had to cut down on their usual activities owing to health in the previous 4 weeks. That in the last 4 weeks, that means in the last 1 month, 11.7 days were like that where they were not willing to work at all. They had to cut down their work. But again, in the final exam, what you need to do, you can avoid reading it too nicely. Can you tell me why it's not important to read it very nicely? Can you tell me why?
Because there is nothing mentioned regarding treatment.
Very nice, Shahin. There is nothing regarding the treatment. Why should I read it again and again and spoil my mind and use my energy and waste my energy? So there was also evidence of substantial under treatment. Now that is where I start focusing, and that is how I save my energy. I utilize my energy. I save my time. This is what exactly is required, guys. This is what it is all about in the finance. Save your energy. So if you understand, if you please can correlate 11.7 days were the disability days or something, and there was one option of 11.7 days. If you will go to that option, you can now eliminate it without even reading it. So whatever this option was, this was given wrong. Helps us. That is what I'm trying and tell you. Focus is all the keys. All the key. Normally, I never read option, but today I read option because the topic was about treatment. So I was trying to find if there is anything that is not talking about treatment. That is why I read the option. Otherwise, I never read the option. But when they are specifically talking about treatment, I thought that if there is something like that, like this, I found it straight away. So C option got eliminated. Now, okay. There was also an evidence of substantial. Substantial is again that adverb I talk about because it is increasing the intensity of the sentence. There is there was an evidence of undertreatment. Okay. There was an evidence of substantial undertreatment, means magnificent, means it was humongous, it was quite a lot. Amazingly, only 35% of the people with a mental health problem had a mental health consultation during the previous 12 months. So, if there are 100 people there, only 35 people are going to consultation. How many people are not taking treatment? How many people are not taking treatment?
65.
65.
Huge number. And that is why they are saying substantial undertreatment. Okay, now let's go further. 3/4 of those seeking treatment, 3/4 of this, 35 are taking treatment now. 3/4 means 75%. Or you can say 3/4. If you don't know the calculations, 1/4 means 25%. है ना? 1/4 means 25%, half means 50%, 3/4 means 75%. अगर किसी के पास 1/4 है तो 25% है, अगर किसी के पास 1/2 है, हाफ ग्लास ऑफ वाटर है, तो उसके पास 50% वाटर है, और किसी के पास 3/4 है, उसके पास 75% वाटर है. लेकिन यहाँ पे एक प्रॉब्लम ये भी है, 3/4 ऑफ दो सीकिंग, देखो ओनली 35% वर हैविंग कंसल्टेशन. आउट ऑफ दीज 3/4 of those seeking help, out of these 35, 75% of the people go to GP. This is what it is trying and say. 65 people no treatment, 35% people, and out of those 35, 75% of 35 is going to GP, means around 28% is going to GP. In 2017 follow-up, not much had changed. Even in 2015, nothing has changed. Again, there was substantial unmet need, and again, GPs were the health professionals most likely. So again, unmet people were too high, and again, the people who are taking the treatment are taking from GP. So this paragraph is telling me two things about treatment. One, people are not getting treatment. Most of the people are not getting treatment. 65% people do not get help, and 35% who get help, unme se bhi maximum are going to GP. These are the two things. So now I need to track my option. So again, in the final exam, please see, save my energy, utilize my energy to the maximum. Now option. %75 of the depression sufferers visit their GP. How many people visit GP? How many people visit GP?
35%.
75% of 35%.
Yeah.
Even lesser, 35 se become. GP struggled to meet the needs of the patient. Did they talk GP was unable to give? Though paragraph sounds like it, but did they say GPs were unable to give the treatment?
No.
No.
They never said it. In reading, it has to be said. Treatment for the depression, she was already eliminated. Most people, 65% people, never received. So in the final exam, I can be confused only about two options. Otherwise, if I'm really not practicing reading in elimination method, then though I'm more confused. I will be this right, this can be right, this can be right. But when you start eliminating, now elimination means you think, why am I? 70% of the depression sufferer visit their GP. They said 35% of the people take treatment. 3/4 of those seeking treatment. So those word has to be read specifically. Only then you would be, otherwise you will go for A and you will lose your marks. OET is not difficult. It's all good. It's just reading requires your attention. Na? So when we say, oh sir, I find reading difficult, that means you find difficulty in concentrating. So put your mobile away for at least 1-2 hours. and especially 15 minutes prior to doing your reading. Now, see, I'm telling you more important things. That we're checking the mobile, then we start doing reading. No. 15 minutes prior to doing reading, leave your mobile phone. Concentrate. Okay? Cool. Nice. So I hope you have understood this question. Any problem with this question, guys? Anything that you would say this or that can be right or wrong?
No, sir.
All good? Okay, let's do one more
Yes, sir.
question. Any question you will say from any question.
Sir, question number 9, please.
Question number 9. Okay. What do the results? Again, what is the main word I will study? What do the results of the
Result.
describe in the so what does studies it suggest also means the same, but when the results were out, what did they suggest? Okay. Always make question very easy. Like in this, treatment was the only word. So try to have less words in your mind when you're going to the paragraph. Okay, in which paragraph? This one or this one? I think this one. Right? Right?
Yes, sir.
You know? Okay. In trying to understand what happens, are you sure this is the one? What was the question? Result of the study. I am not getting study in this. No, that's why it was found. Okay, study. Yeah, I found it was found means obviously in the study it must be found. Okay. That is why I teach you active and passive, guys, while writing. It was found means it was found by a scientist who was doing the
Scientist.
study. That is why passive voices are so important. That is when we do writing, we say patient was found with elevated temperature, bias. Patient was diagnosed with bias. Home visit के केस में patient was visited at his home. Home visit में सबसे important punch चाहिए. The patient was visited at his home. Writing में. Okay, chalo, let's come back to reading. In trying to understand what happens when GP feels stuck while treating someone with depression. So GP is stuck. He was treating a person with depression. A quality study was undertaken. So there was a study that was undertaken that aimed to gauge the response of GPs to term difficult to treat depression. So what was the aim of the study? To gauge the response of GP. Even I don't know the exact word gauge, but whatever the word is, I will try to avoid this word. To that was aimed to know the response. I will try to change the word because I want to understand this. To know the response of the GPs to the term difficult to treat depression. So difficult. Now imagine difficult to treat depression. That means a patient of depression is coming to me and I am having difficulty. So the main study was aimed to find the response of GPs. It was found that while there was confusion around the exact meaning of the term, that there was confusion. What is the exact meaning of this term? GPs could relate to as broadly. Broadly always means broadly, just like that. Broadly encompassing a range of individuals and presentations. More specific terms. Now see, difficult to treat depression is a broad term. And it contains encompasses means it contains range of individuals and presentations. Overall, it wants to say difficult to treat depression is a very broad term and it contains so many individuals, so many range of disorders. More specific term such as treatment resistant depression are generally reserved for a subgroup of people. That means difficult to treat depression is a general term, but treatment resistant depression is a very specific term only for a subgroup of people with difficult to treat depression. So difficult to treat depression is a bigger term, and in this there are some group of people we say they are treatment resistant depression. They have that has failed to respond to the treatment. So treatment resistant depression is the term generally reserved for the people who failed to respond to the treatment. with particular management implications, that even after giving some particular management implications, they did not recover. So the whole study is about that treatment of depression is a broader term, and under that term, there is a term known as difficult to treat depression, which is very specific. So overall, I got this. There was nothing much I could get. GP prefer the term. It was given GP prefer which term? It was given GP prefer or not? Anything that GP prefer? There was no preference given. And second, that is why I told you I only teach three things: adverbs, grammar, it was found, and now degrees. It is a comparison. There was no comparison given. Degree, I use the word for comparison, that he is better than you, it is better than this. Prefer word is also kind of a, it's not a degree, but it is giving me that feel, it's comparing. They did not say GP is happy with this. They said difficult to treat depression is a broader term. Treatment resistant depression is a specific term. They did not say which GPs prefer. So how can I do it? Patient with difficult to treat depression gets stuck, or GP gets stuck. What was given?
GP gets stuck.
GP got stuck.
To eliminate. The term difficult to treat depression lacks a precise definition. There is a vocabulary, and whenever you talk to me, even while you make the first call to me, I always use this word precise. And it is a regular word of OET and your general life as well. Precise means accurate. So difficult to treat depression is a broad term. That means it does not have a precise definition, but that's fine. If you don't know in the exam, sir, if I don't know, I will eliminate. That is what I'm saying. You don't know, how can you eliminate? So this can be our answer in the final exam when there is a difficult vocabulary change. If you don't know how and why did you eliminate, that is my question to you. So hold on. There is an unidentified subgroup of patients with difficult to treat depression. There was nothing like given. There is an identifiable subgroup of patients with difficult to treat depression was having lot of people. It could not be identified. Identifiable people were treatment resistant depression people. They were specific. They were identifiable. So then I say, nah, because difficult to treat depression, again, I will tell you, don't get confused. In 1 minute, I will solve your problem. Treatment resistant depression is reserved for subgroup of people. There is identifiable subgroup of patients with difficult? No. Treatment resistant people are generally belong to that subgroup, which is identifiable. So 2 were gone easily. Third is here. And then I think difficult to treat depression, legs. And when you are a part of Dr. BKM, there is a vocabulary video I will post in the group right now while talking to you. And I will also put it, if you're not part of us, even then I will put it in the status. So you will get it right away. Vocabulary. And this is a very special vocabulary. And even if you talk in English, don't worry. Still go through that vocabulary. It would be very handy. And there are more vocabulary videos like this on our channel. But this has been maximum liked by the people, like almost like 700 people liked it. So I am sending you on status as well as in our groups. Online query. Just 1 second. Okay, send to all. So I've shared the video and also it has gone to the status as well. So please go through this vocabulary video and rest. We'll catch you the next time. Thank you for being here today and attending our lecture. I hope you enjoyed and learned something. Did you guys learn?
Yes, sir.
Enjoyed?
Yes, sir.
Again, some things are easy, some are difficult. But difficult things are also enjoyable. It's not necessary that thing is difficult, it is not enjoyable. It's how we take it. So try to enjoy your reading, even if it's difficult. Try to give it time, try to be slow. Difficult questions should be avoided, easy questions should be done. This is how we achieve our goals. This is Dr. Bhupesh from Dr. BKM Institutes. We'll upload this video on the YouTube so that you can see it. Thank you.